Hi guys, it's Gina. I'm here at RSNA 2017 in this GE booth that is amazing. I have found myself in the ultrasound department with Nancy, who is an expert and going to tell us about some great new technology. Nancy, it's wonderful to meet you.
Thank you, Gina. What we'd like to talk to you a little bit about today is our newest technology. It is the Logiq XT Clear S8 2.0. And what is so phenomenal about this technology is we have really looked at the liver care continuum and liver disease. Liver disease is on the rise, as many of you know. It's the #1 growing cancer worldwide. And what we've tried to do here at GE is really understand how can we help our clinicians diagnose, monitor, and treat those patients earlier. What we've done is we've integrated with a company called Echosens. They have a technology called FibroScan, which is an elastography technology that allows us to look at the liver tissue stiffness as well as the liver fat content. Why that's really important is that fat is the precursor for liver disease. So as you are looking at patients and trying to determine if they're at risk for liver disease, what we're finding is that the sooner you can diagnose fat, the earlier they can get treatment.
Great.
FibroScan technology is the only technology that can non-invasively assess fat. In addition, we have all of the imaging capabilities of our Logiq system that allows us to look at the liver to determine if there are masses in the liver, if there are any problems with the liver, so that when we go to assess the liver with FibroScan, we have a very easy way to get that information.
So it sounds like you're getting early detection and accurate detection, less evasive to the patient.
Absolutely. There are over 1,600 clinical papers identifying the technology and how well the FibroScan technology works for liver assessment and for fat assessment. And the other thing is that FibroScan is the only technology that is being utilized to help decide when the patient needs to go on a drug for liver treatment.
Okay.
So there's a drug called Harvoni, and FibroScan is one of the criteria that a patient needs to have in order to qualify for those expensive drugs.
Got it.
And so it's very critical that they do that. Previously to this, they had to go and have a liver biopsy.
Yes.
Painful, invasive, and if you're trying to monitor somebody over time, liver biopsies every 6 months to a year become really, first of all, they're very painful and awful for the patient. Second of all, they're very cost ineffective. And this is a way that we can replace those liver biopsies with FibroScan.
Yes, and give the requirement to get that prescription that they need.
Absolutely.
So that's
in
amazing.
addition to that, the system has all imaging capabilities, not just for the liver, but for every other type of ultrasound exam. So if you wanted to use this system, let's say, to look at vascular flow, if you wanted to use this system to look for OB information, this system does all of that. It also does needle guidance, so it helps with when you're doing an actual treatment procedure. There's just so many things that are in this system. We like to think of it as the 2-in-1 system. It's got all of the capabilities to treat and assess liver disease.
Well, that all sounds amazing. Now, do you think that Corey would be willing to show us how it works?
I think Corey might be willing to show us how it works.
I'm going to pass this over to Corey, and he's going to demonstrate how this amazing new system can help show us a little more about the liver. Corey, I'm going to clip this on you. Get close and personal there.
All right. I'll start my FibroScan acquisition by first obtaining an image of the area that I want to sample with the FibroScan. Once I've looked for proper patient positioning, depth from the liver or from the skin to the liver surface, I'll enter into my FibroScan mode. Upon entering the FibroScan mode, I'm going to take the transducer and apply it to the area where I obtained my sample image. FibroScan acquisition is simple, easy, and has numerous quality indicators to ensure that we get reliable, accurate, and repeatable samples. Once my indicators assure me that I'm in the right position, I'll go ahead and obtain my samples. The patient simply lays still. The respirations do not have to be suspended, and I simply take 10 samples. I can
Now,
look at my
Nancy, is
indicators
this
to
patient
ensure
in
that I've
pain at all?
obtained a quality
Not at all.
sample.
This is a very painless treatment. Basically, all we're doing is we're just sending a slight pulse into his liver so we can get these readings. It's very quick, very fast, non-invasive, pain-free, and a very easy way to get those assessments.
Okay, good. Just wanted to make sure he wasn't putting himself out there all day.
No. Does he look like he's in pain?
That's true.
After I obtain my samples, I can enter into my worksheet mode. Excuse me. Let's try a few more here. I think I might be on a rib there.
One of the unique things about FibroScan as well is we have two probes so that you have different patient types. So you have a probe that's called the M probe, which Corey's using right now for patients with slender or normal body habitus. Then there's an XL probe for those patients that might be a little bit larger.
Got it, got it.
Once I've acquired my samples, I'll enter into the FibroScan report. I've got my quality indicators to demonstrate the FibroScan attenuation. My CAP value can help me to determine the level of steatosis in the liver, and the speed will also help me to determine the level of fibrosis within the liver for our comparison charts.
One of the great things about this technology is because it's integrated into our ultrasound system, this can be done in a radiology lab. If a hepatologist has a FibroScan unit in their lab, they can scan their patient and determine the level of liver disease, and then they can be serially followed with the ultrasound system, where we can use more advanced tools like imaging shear wave and needle navigation and all of those things so that we can follow through. So the fact that the FibroScan technology on here is exactly the same as a hepatologist might have in their lab allows us to follow that patient consistently with the same numbers and make sure that we're getting consistent data over time.
Wow. Well, I'm gonna sneak this back, Corey. Thanks so much for showing us. And thank you, sir, for being such a good patient. Nancy, I appreciate all of this information. It sounds like this is a great new technology that's going to save time for patients, eliminate any chance for errors amongst doctors, kind of sharing this information and getting to answers faster, which, I mean, patient care is our most important thing here.
Absolutely, absolutely. We want to make sure we're getting to that liver care continuum early and quickly so that we can intervene on those patients and make sure they have a better quality of life.
Well, thank you so much for telling us and showing us. We really appreciate your time. And if our ICE readers want any more information, comment below and we can get you in touch with the right people. Thanks for watching.
Thanks, guys.